Good morning, everybody. This is a pleasure for me today to start this podcast. This is Dr. Avinash Jayaswal. I'm Chief Medical Officer at CCM Health. I would like today to talk about value-based care in the context of Medicare's effort to curb what are continuously rising healthcare costs in America. So value-based care goes back to the Affordable Care Act, which was voted into law in 2010, and which was again confirmed in 2016 bipartisanly in Congress. So value-based care is here to stay. And it is different from what was transactional before, that is the model of fee for service. Now we are looking at a model where patient outcomes and quality of care determines scores of providers and eventually their revenue as well. So I will dive into how value-based care has been our driving force as well at CCM Health, and that is because we have embraced technology and we also have the human aspect of care, both. So we are staffed through a federal grant with nurses, and our nurses do the patient follow-up. And they do that in a manner which is very extensive, taking into account, of course, the vital parameters, all the instructions of the providers, and going over the medications, going over the activities of daily living. We're talking about a geriatric population, so also talking to them. People sometimes just need to talk to somebody, and there's a very special link that is created with caregivers. So that is also something not to be ignored. And we are looking at also in the same context, behavioral health integration. They do some depression monitoring, anxiety monitoring. They do also weight management, which is a difficult target to have because that is a struggle for everybody, and first and foremost of patients, but still we keep an eye on that as well. And then they look at also the instructions of physicians to go and see a specialist, tracing the referrals back, making sure the information goes from one doctor to the other, closing those gaps to zero, because that's how quality is ensured. And we are looking at 100% closure of clinical care gaps. This is done by continuously engaging with patients, and also our physician liaison who talks to our nurses and to other physicians who work with nurses and communicate that information to the providers. So we have a full cycle of information where the attempt is to have no information that gets lost, and hence quality is ensured. That is the CCM program, which is the pillar of what we do in population health. The other aspect, which is cornerstone, is technology, because without technology, value-based care is just not possible. We are talking about using artificial intelligence, machine learning, remote patient monitoring, which is collecting data of patients in the comfort of their homes in an active manner, and that data is read and processed and used for information in order to decide what is it that needs to be done. Is it necessary to act before an emergency situation arises? This again is in the whole idea of prevention, quality of life, and avoiding those emergency situations which take up so much of resources. Medicare wants to go in that direction because the projection going forward January 2022 is that costs of healthcare in America are going to keep rising. So prevention is one of the pillars of Medicare's strategy to curb those costs. And we participate not only in the human aspect, the technology aspect, we also bring about expertise in the regulatory aspect, because that's where it all comes together and makes sense. For the provider, we offer them a host of expertise that we have. So we have in our team people who are experts in Medicare, in revenue cycle management, in risk stratification, in practice optimization, in population health and compliance also. So all these aspects, we have people who are at the disposal of course, CCM Health, but of our partner providers to position them in the best possible manner in order to be on the receiving end of all the advantages that Medicare puts forward in order for providers to do preventive care. Better scores, better parameters, better metrics means better revenues, better growth, and better opportunities for the practice going forward. So these the three aspects which I discussed is what we have as our bread and butter at CCM Health. And we participate and very proudly in contributing to a better healthcare system in America by doing population health with our physicians in the company, our executives, everyone, our nurses, of course. We are contributing. We have our own proprietary software, which plugs into the EMRs. That's also one aspect which makes care a little bit more complicated because there's so many different EMRs. Our proprietary software piggybacks on just about every EMR, which makes it possible to do those continuous monitoring of care. And yes, this is something which is active. So we'll be, of course, continuing to bring new ideas to what we do. Hence, I invite you all to join in the discussion. If you have questions, please go ahead. You can write them here, or you can contact me by email. And I look forward to discussing about value-based care. This is the new norm in America, and we look forward to doing well in this beginning of this new year and going forward. Thank you very much, guys. Have a good day. Stay safe.